Linked color imaging reduces the miss rate of neoplastic lesions in the right colon, a randomized tandem colonoscopy study. Introduction. Colonoscopy and polypectomy prevent incident cases of colorectal cancer by detection at an early and curable stage, and by identification and removal of colorectal precancerous lesions. However, although colonoscopy is highly effective in preventing left-sided colon cancers, large population-based studies have demonstrated that it provides limited protection from right-sided colon cancers. This discrepancy may be attributed in part to different tumor biology between the proximal and distal colon, but largely results from missed precancerous lesions at endoscopy, which are more likely to be located in the proximal colon. Specifically, the proximal colon is often more difficult to cleanse than the distal colon, resulting in suboptimal mucosal visualization. Moreover, the proximal colon may harbor a greater prevalence of neoplastic lesions that are macroscopically more difficult to distinguish from normal mucosa, such as flat or non-polypoid lesions that may more likely contain invasive carcinoma. Similarly, sessile serrated adenomas and polyps, SSA and P, with subtle appearance and unremarkable color, are usually located in the right colon. Last but not least, the interhaustral spaces are quite deep in the right colon, and polyps are frequently located on the backs of haustral folds and on the inner curvatures of colonic flexures, eluding the view during scope withdrawal. In view of these challenges, great efforts are currently being made to develop techniques or technologies that could potentially improve polyp detection in the proximal colon. Two recent meta-analyses and systematic reviews have clearly demonstrated that double rather than single inspection of the right colon during the withdrawal phase of colonoscopy significantly increases adenoma detection, irrespective of forward view or retroflexion assessment. Moreover, over the past decades, many technological devices have been introduced to improve the detection of neoplastic lesions by enhancing their endoscopic visibility. However, in this context, image-enhancing endoscopy systems such as narrowband imaging, NBI, flexible spectral imaging color enhancement, FICE, and autofluorescence imaging, AFI, have generally been shown to be ineffective in improving adenoma detection. Linked color imaging, LCI, is a newly developed image-enhancing endoscopy technology that differentiates the red color spectrum more effectively than white light imaging, WLI, thanks to its optimal pre-process composition of light spectrum and advanced signal processing. This technology, combined with the new high-performance LED illumination system in the latest generation of Fujifilm endoscopes, is now available in Europe, Iluxio, Fujifilm Company, Tokyo, Japan, and enables the creation of bright images of relatively distant targets and enhances the visibility of colonic mucosal vessels. Both of these features possibly increase the detection rate of colorectal polyps. To date, the only available evidence on the impact of LCI on adenoma detection comes from a crossover, randomized, back-to-back study from China in 152 patients, which showed significant superiority of LCI over WLI in terms of polyp detection. Similarly, results from a recent video-based study indicated that LCI improves the visualization of lesions located in the right-sided colon compared with WLI. However, these studies were carried out in Eastern countries where a different video endoscope is available, Laserio, Fujifilm Co., which uses two lasers with different wavelengths rather than LED as the light source. Taking into account the clear-cut benefits of double inspection in the right colon, the authors conducted a prospective, randomized, back-to-back study aimed at evaluating whether LCI could further reduce the miss rate of lesions located in the right colon compared with high-definition standard WLI colonoscopy. Background and study aims. Linked color imaging, LCI, is a newly developed image-enhancing endoscopy technology that provides bright endoscopic images and increases color contrast. The authors investigated whether LCI improves the detection of neoplastic lesions in the right colon when compared with high-definition white light imaging, WLI. Methods. Consecutive patients undergoing colonoscopy were randomized 1-to-1 after cecal intubation into right colon inspection at first pass by LCI or by WLI. At the hepatic flexure, the scope was reintroduced to the cecum under LCI, and a second right colon inspection was performed under WLI in previously LCI-scoped patients, LCI, WLI group, and vice versa, WLI, LCI group. Lesions detected on first and second pass examinations were used to calculate detection and miss rates, respectively. The primary outcome was the right colon adenoma miss rate. Results. Of the 600 patients enrolled, 142 had at least one adenoma in the right colon, with similar right colon adenoma detection rates, R-ADR, in the two groups, 22.7% in LCI-WLI and 24.7% in WLI-LCI. At per-polyp analysis, double inspection of the right colon in the LCI-WLI and WLI-LCI groups resulted in an 11.8% and 30.6% adenoma miss rate, respectively, p less than 0.001. No significant difference in miss rate was found for advanced adenomas or sessile serrated lesions. At per-patient analysis, at least one adenoma was identified in the second pass only, incremental ADR, in 2 of 300 patients, 0.7%, in the LCI-WLI group, and in 13 of 300 patients, 4.3%, in the WLI-LCI group, p equals 0.01. Conclusion. There is potential for PCSP to become the standard of care for non-dysplastic large SSPs. This could reduce the burden of removing SSPs on patients and healthcare systems, particularly by avoidance of delayed bleeding.